A new report suggests that having children aged 3 and 4 go to a full day preschool rather than part day better prepares them for kindergarten and beyond. Kids in full day programs showed stronger gains in socio-emotional development, language and literacy skills, and math. Their attendance rates are also better. There's a new center in Memphis to help care for children who need emergency medical care. The Spence and Becky Wilson Baptist Children's Hospital opened recently. The 17,000 square foot emergency department is next to Baptist Women's Hospital.
We projected we'd get about 20 children a day. We're averaging 40. We've had a high day of 53. And it's been orthopedics, it's been a lot of respiratory because it is the flu season, and RSV and those type things, asthma.
There's a pediatric diagnostic area called PD's Perch on the first floor next to the pediatric emergency room. And when your child is hurt, it's good to know that quality emergency services are close by. But how do you know when it's a problem that requires that level of treatment? Doug Johnson has more on how you can protect your child's health and know when to take your kids to the ER.
It's not how Joseph Strain wanted to spend his day. He and his family have been in the emergency department at the new Spence and Becky Wilson Baptist Children's Hospital. His mom brought him in after checking with his pediatrician.
My son was complaining of his stomach hurting, and his mother called me, and I said, call his doctor and see what he says. And the doctor told her to get him here immediately, and from what she was describing, it sounded to me like he was having his appendix was bothering him a little bit, and sure enough, they ran the CT studies, and so we're just waiting here to get our final results back.
It can be tough to know when to decide to take an ailing child to the ER. Emergency nurses will triage patients as they come in. That is, they'll find out what's wrong and prioritize who needs immediate care and who can wait. They base their decisions on a patient's chief complaint and their vital signs. The sickest patients go to the doctors first.
Those type of patients will take priority. Patient coming who's like unconscious, having active seizures, have very low blood pressure. So those are the two big warning signs that usually it's picked up at the triage area.
Now, there are a number of things that can lead to a visit to the emergency room. Many times the problem is serious enough that the decision to come here is automatic. Depending on when the problem happens, parents may have the opportunity to talk to a child's pediatrician first.
However, after hours, the options are more limited, and the concern is greater. Should I wait? Should I not wait? And parents are nervous. The answer is different by age groups.
Check with the child's doctor whenever you can. But with babies, parents should be concerned with even minor things that can get worse quickly. If they're lethargic or don't seem as awake as usual. If they have a fever, feel cold, or aren't eating or drinking like they usually do. Older children, like Joseph, can tell parents when something's wrong, but there are also signs their parents can watch for just in case. If their condition gets worse quicker than expected, or if they're just not improving as expected. And with any age, there can be a serious risk of dehydration. According to the manager of pediatrics at the hospital, the emergency care team will work to educate parents while they're in the ER, letting them know how to care for their children at home.
So anything that we can do as far as teaching things like when to give Tylenol, when to give ibuprofen, when to call their pediatrician, maybe not to get so sick before an emergency room is needed, is very important.
And because of the wide range of problems that can bring children to an emergency room, parents should know that it may take longer for some children to be cared for, but that's only because other children may be a lot sicker.
You may have to wait a few moments while we take care of another child who might have come in after yours, and we apologize for that, but it's smart medicine.
I'm Doug Johnson for Smart Medicine.